All right, we're back here with LinnFit Coaching Podcast, and man, I missed this. We've we've had a little bit of a hiatus here, a little bit of a break, and so we're back here today talking about soreness. This is something that if you train or if you do a sport or you try to take care of yourself physically, at some point you'll probably experience soreness in your life. So we'd like to educate you a little bit about it today. We want to talk about soreness. How much is too much? How should it affect your training? How should you approach it? What is it in general? So let's dive into this podcast today. All right. All right. So we are talking about soreness, or even just like fatigue in general, whenever your body feels kind of broken down. So why do we get sore?
Well, as we're training, doing different movements, lifting different weights, running or whatever it is, we're breaking down that muscle fiber, and it eventually is going to build itself back up. That's how we get stronger, or grow our muscles. But that breaking it down and everything that causes inside our bodies is what's going to really lead to that soreness and lead to that stiffness potentially going forward.
Yeah. Whenever you're training, you make these little tiny microscopic tears in your muscle, which is a good thing because your body adapts. So when you put a demand on your body that's not used to, it sort of breaks you down a little bit. It builds back stronger and better able to meet that challenge or demand again. So it's a normal thing. It's a normal part of training ourselves, and it's a normal part of what we call progressive overload. You overload yourself with something so that you can meet that challenge again the next time you do it, whether that's weightlifting or whether that's trying to build an entirely different new habit, like say you're trying to cook. I'm going to start by making a snack, something like that, where you start to get more and more of a capacity to do that.
Right, and that kind of progression, you can really see that if you change up your workouts and do different ones. You may be a little more sore, even though you feel like you maybe did a little bit less work than normal, just because it's different to your body. Your body hasn't really adapted to that new style of training potentially.
Yeah.
So that's a big reason why you get new, different soreness than typical if you change things up.
Yeah. So that's part of a good thing to add into our training regimen. If you feel like you're sort of stuck, then adding something different in. If it makes you sore, then it's probably an effective dose. You're like, oh wow, that was something that my body wasn't used to. That's helpful. Mm-hmm. That can be potentially really good for us. But so soreness is something that happens, and it's funny how we typically don't feel sore immediately after. So that you can feel sore at different times. If you're kind of untrained or you haven't been training for a while, then you might feel sore the same day you do a workout, or you might begin to feel sore, or you might get what's called DOMS, or delayed onset muscle soreness, where you feel fine, you're like, oh wow, yeah, I'm good to go, and then 2 days later you're like, whoa, I can't move. So it's kind of a crazy phenomenon, but either way, the soreness comes, and it does eventually go away. So let's talk about this soreness, how sore is too sore?
Yeah, I think a lot of people kind of wear soreness as this badge of honor almost. They, oh man, I'm so sore. I worked out so hard. And there's some validity to that. You're working hard. But if your soreness and how you're moving is affecting other areas of your life, if it's negatively affecting your relationships or your work or different things like that, then, that's not really the point of training. Is you're training and your workouts are meant to enhance your quality of life, and so if they're negatively affecting other areas of your life, then maybe that's too sore. Maybe you're not recovering well and not actually getting the full benefit of what you could be from your workouts.
Yeah, it's true. There's lots of things. There's lots of signs that you're too sore. If performance matters to you, if you're an athlete and you're trying to perform for your sport, and if your training gets you too sore to be able to perform, then of course that's too sore. You did too much. You overtrained. If it's starting to affect your sleep, or your joints start to hurt, or your appetite's affected. That might mean that you're training too much, that your soreness is too heavy. It's been too much of a demand on your body. But also, if your soreness just isn't going away, that's a sign that there might be other things going on that's not allowing you to recover. Like you're sore for more than a couple of days. Then it's like, wow, either this is the first time I've done this in a while, which is kind of normal if you're sore for 3 days before it really starts to go down. If you are detrained, haven't trained in a while. But if you've been overtraining, you've gotten too sore, didn't give yourself a break, and it just doesn't go away, then you'll probably notice not only is the soreness not going away, but your sleep isn't good, you're dehydrated, you're struggling in a lot of areas. You might even have other things like headaches, joint pain, hormone stuff, and so that's just showing that there's too much of a breakdown for your body to handle. But yeah, like you said, like with the function of daily life, that gets tough. But then if you're not able to perform for your next training session, like let's say, after 2-3 days, you want to hit something similar, a similar type of movement, and you just can't do it because you're too sore. Maybe you hit it a little bit too hard, and so you're not able to get a better overall training regimen because you did too much in a single session.
Right. If you have to increase the amount of rest days beyond a certain point because you're working out so hard on those other days, then spreading out that work over the entire week or however you program for yourself is going to be a lot more effective in the long run.
It's true. I mean, I get it. There's some days I'm just excited to train. I'm like, man, I feel awesome. Like I'm rested, I'm recovered, I'm good to go. I feel 100%. And like I'm just with, some friends in the gym. I just want to hit it hard. And at the end of that workout, I'm like, man, that was a great training day. And then I can't get out of bed the next day. Mm-hmm. I'm like, well, whoa, went way too hard. Like now I got to really try to come back and recover. But like with that rest day, like what's an ideal rest day? Or how many ideal sort of number of rest days to have? Or how can you sort of come back from it if you are really sore?
Yeah, if you are really sore, a big temptation for me in the past has been to just do absolutely nothing. Do as little as possible, which, sometimes maybe that's exactly what your body needs. But I think just getting out and whether it's walking or jogging or playing a sport for some light activity, doing something to keep the blood moving in your body is going to be really effective just to help you keep moving. I know a lot of people also use like fitness trackers or different things that kind of help them like understand how they're doing to kind of like take steps to mitigate overtraining. So how have you seen like using different apps or different things affect your recovery and your training?
Yeah, I mean, I'm a constant learner, constant student of my profession, and so I love testing out different technologies to see how it can better inform the programs that I make for myself or for athletes or other clients. And so fitness trackers can be really useful. You understand that they all have sort of a degree of error, so it's not perfect, but they can make you well informed. So for example, if your resting heart rate is elevated a lot higher than it's normally been, then that is a sign that you need to, chill out. You need to recover. You need to do less. You might also feel it in the, symptoms of soreness, fatigue, or other things or other stress. And so it's just showing you're not in the best recovery state. HRV is one of the best indicators of recovery and your ability to perform. And so that's just your heart rate variability. And that's most accurate if you're wearing a chest strap and you measure it as soon as you wake up in the morning and while you're still lying down. But not everyone does that. So often they wear like the wrist wearable and that is going to have a higher degree of error, but you can still get sort of an idea. And so it's not something to trust 100%, but you still can get sort of a ballpark number, an estimate. Or like, okay, it's lower than it's normally been, so that means I need to recover. And if your respiratory rate is elevated, you're taking more breaths per minute than you normally do, that just shows that your body's in a state of stress, just like the heart rate or the heart rate variability. And so it just means you're breathing more because your body's trying to get more gas exchange going on, to get to deal with this, this acid buildup, these accumulation of things that are in your bloodstream that wants to clear out. So it's just kind of inviting more blood flow. And so those are a few indicators. I mean, with the wearables and the fitness technology, they're really useful. But with this, ideally you shouldn't need more than one, maximum 2 recovery days. But a recovery day doesn't necessarily mean that you do nothing, like you said. Like, in fact, sitting around doing nothing is probably going to make things worse, because even if you're not sore the next day, you're stiff. Mm-hmm. And so our bodies are designed to move. And so the more movement you can give your body, the better it's going to feel. And so on a rest day, that might mean that you may not train intentionally, try to overload your body, but you still do something active, get outside, get out in the sun, do something active, like you said, like it's a sport or some kind of chore or something like that outside. Just be moving intentionally, like walk and talk on your phone, whatever it needs to be. And sometimes if you're part of a gym where you just like to go and be there, maybe that means you intentionally don't do a serious workout, but you just get on a bike there and you just kind of spin for 30 minutes. So you just get some blood flow going. So it allows your body to push blood flow where it needs to go without overloading the tissues and making the soreness worse. Mm-hmm. And so if you're having to take more than a couple of rest days of, light movement or no movement, then you overdid it.
So you have been training pretty effectively for many years. Mm-hmm. How often do you still feel like what you consider kind of excessive soreness, like more than just a typical, like, oh yeah, I mean, I did a little training? How often do you feel something that is a little above average for soreness?
That's a good question. If you've been training consistently, like, you'll feel sore every week. If you're doing if you're doing like training is trying to maximize your fitness level where you're at, and if you're trying to change it up to make sure your body's still adapting to keep your metabolism high and working hard and everything. But whenever it's a higher degree of soreness is whenever I'm doing something that's a different volume than I've previously been doing. So let's say if I'm working on being strong, I'm going to have a lower volume of reps, a higher amount of weight, but then one day I'll just hit a certain area with a bunch of reps, and then I'm sore for like 2-3 days. And it just lingers, and so like whenever I am struggling to sit down on a chair, or like I'm moaning and groaning every time I get up and down or something like that, or if my gait, like the way I walk, is affected because of my soreness, I'm like, all right, that's a higher degree of soreness than normal. Mm-hmm. And it's not wrong to have that sometimes, but if you push it too hard, then it can affect you in a lot of ways, which we've kind of already talked about. And we do need to bring up how there is people are at the highest risk of really overdoing it are someone who's an absolute beginner who tries to start out in a program that's too advanced for them right now, or even more so, someone who was previously fit and jumps into a program that pushes themselves like they are still fit. Mm-hmm. So someone who was previously very fit got unfit, whether that's over months or years, and then they go and do something really intense, high volume. That high volume may not be necessarily high in their mind of what they may have previously been capable of, but according to their current capacity, it's high. And so that's when something that's called rhabdomyolysis could happen. And so it's a fancy term of your muscles are like dying inside. So they're like breaking down, and literally like toxins are being released in your blood. So I don't want that to scare anyone. That's highly, like, incredibly rare, but has seen it a couple of times. And so, and it's a scary thing because it typically only happens in like major accidents, like a car accident where your leg gets pinned under something and then blood is cut off and it kind of kills the tissues. But it has happened in the fitness realm. before. And so it's a scary thing, but also that just means like, okay, if you're a beginner, make sure you sort of ease into exercise. Don't overdo it. No matter how excited you are, it's good to start off with something that's attainable and just listen to your body. And then if you were previously like a pro, like you were really fit and consistent, but you got really inconsistent for a while, then again, ease into it. Listen to your body. Don't go to failure on anything so that you don't get too sore.
Right, and I think, at the beginning of a training block, whether you're working with a coach or if you're just deciding to do your own program, just being willing to accept where you're at that day.
Mm-hmm.
I mean, even if it was 6 months previous and you were a lot stronger or a lot fitter than you were before, just consider where you're at right there and decide to take steps forward.
Yeah.
It's going to be a lot more effective to helping you avoid any problems like that.
That's really true. I mean, I think a lot of coaches and individuals can get, so stuck on like, I have to complete the program. But really, like when it gets to a higher fitness level, if you're willing to listen to your body and its own recovery, then you can actually over time build a better fitness rather than breaking yourself down and having sort of the endless cycle of like push yourself really hard, get hurt, rest a while, get out of shape, then push yourself really hard, get hurt, rest a while again. So, but if you continue to listen to your body, those may not happen. Those cycles may not happen. Then you get more consistent.
Mm-hmm. Yeah. So talking about consistency, if you are sore, you did work out hard maybe yesterday or a couple days ago, should you work out again?
I think you could definitely work around soreness. So it kind of depends on your level of soreness. Like if you are, especially like if in big muscle groups, you are really busted up, or in your core, you're really busted up where it's just like hard to do anything without feeling busted up, then it might be good to like wait another day. But generally you can usually work around it. I would just recommend that you work another area. Like if your lower body is pretty sore, then focus on your upper body. Or do something, change up your exercise, change up your workout. So that's maybe if you're sore from strength work, maybe your body still needs time to recover before another significant strength day. And so you want to work in a little bit more of a cardiovascular day or an accessory day where you're working on just the little things that really help you move better and have healthier joints. So there's always ways to work around it. So does that answer your question?
Yeah.
Yeah?
I think so.
Yeah. I think there's always ways to work around it, but we can always, but if listening to your body, if you feel too busted up, then it's not wrong to rest or just kind of take an active recovery day.
Right. Yeah, I think one thing you talked about was just kind of changing the volume or changing, what you're doing potentially. And I think that's a definitely an important thing for people to understand. As you're going through it, potentially if you're hitting a strength cycle and you're going day after day and just trying to get stronger, but you are feeling a lot of joint pain, you're feeling fatigued consistently, maybe lowering that like RPE or rate of perceived exertion and maybe like the load that you're actually lifting, reducing that a little bit to help you string together consistent training days throughout a week can be really effective toward the end of your cycle when you are potentially peaking for something. Being able to string those good days together is going to help you a lot.
Yeah. I mean, I like that you mentioned the RPE. That's a good scale. It's just a scale of like on 1 to 10, how hard was that at the end of your workout? And if you have too many days in a row where you're like 8 to 10, then that's essentially taxing your body in such a way that you're setting yourself up to getting hurt or getting sick. So, I mean, that's just signs of overtraining. And so with the RPE, like it's related to your central nervous system. And that's just like the inner circuit board of our bodies that helps us everything happen. So it's from your brain to everything else. And so if that gets overtaxed, then we start compromising in our focus, in our movement, and in lots of other things. And so you get signs of overtraining, like your digestion's messed up, your focus is messed up, your joints hurt, your soreness isn't going away as fast as you want, your sleep is off. You might catch a cold easier, you're sniffling a little more. So these are all signs of overtraining that you need to watch out for. And so usually like an RPE, like if I'm going on a scale of 1 to 10, like I'm only want a couple of days a week. Ideally, they're going to be like an 8 to 10, like I'm maxed out on the floor, like dead for a good stimulus. But you want to separate those couple of really hard days pretty far in the week, a few days in between, so that you can maximize those days to get the best out of them. And other days, you might change it up to be more of a strength day, or like a slower pace day, or more of a long cardiovascular day where you're not going to have that 8 to 10 difficulty, but it's kind of maintaining that base to allow you to go hard on the next day.
Mm-hmm. Absolutely. Yeah, I think I hope what people are hearing from this is that you don't have to go hard every single day to get really fit or to achieve your goals, but it's also okay to work hard and to feel soreness. That's not a negative thing either.
Yeah.
So I hope you guys can see that somewhere in the middle is what we're shooting for.
Yeah,
so.
If you're not getting sore, you're not working hard enough, you're not going to see a change. And so if you're working out, you don't get sore, then you need to change up your workout and work a little harder. If you're getting too sore, then find a happy medium where you can dial it back a little bit, still get some good fitness gains.
Yeah.
So, all right, this is good. Man, we can get sciencey on this sometimes, but we love it. We're passionate about this, and man, we love trying to bring content that adds value to anyone who's listening or watching. And so if you guys want more content like this, and let us know, give us feedback. We want to hear from you guys. Reach out to us on Instagram or at linnfit.com. And if you want more guidance in this, if you feel uncertain of your strength and conditioning program, whether you're an athlete or just an average individual, we want to help you guys. We're here in our online coaching business at LinnFit Coaching to help people in strength and conditioning and in nutrition. And we're here to serve you. So we'd love to hear from you guys, but thanks for tuning in today. We'll catch you on the next one.